Hi, my name is Anne Winfrey. My clinical scholarly project is aimed at awareness creation and improvement of breast cancer health outcomes in an underserved immigrant female population through early breast cancer screening. This can be achieved by the provision of culturally and linguistically competent care. Breast cancer is the most common malignancy found in women residing in the United States and second to lung cancer in mortality rate. Breast cancer is associated with a substantial economic and financial burden. An estimated 3 million women in the United States lived with breast cancer in 2012, and 200,000 new cases are diagnosed every year, and about 40,000 deaths occur yearly due to breast cancer. Early breast cancer screening through mammography and breast self-examination is recommended by the American Cancer Association because early detection and treatment has been proven to reduce mortality rates. Breast cancer-specific 5-year survival rate has steadily increased in the United States, but it has steadily decreased among minority populations. This disparity in mortality rate is attributable to disparities in early cancer screening, diagnosis, quality of treatment, and follow-up care. Inaccessibility of healthcare services and lack of knowledge are some of the reasons for the underutilization of mammograms. Providing a culturally and linguistically competent care will help bridge the gap in breast cancer mortality rates. Some of the stakeholders identified for the successful implementation of this project are policymakers, advanced nurse practitioners, especially those in primary care settings, public health nurse educators, registered nurses, licensed vocational nurses, medical assistants, radiology staff, patients and their family members, respected community leaders, and religious leaders. The educational needs of the policymakers, the nurses, public health workers, and vocational nurses and medical assistants will be in a form of providing culturally competent care to our patient population. The patients and their families, respected community leaders, and religious leaders are going to need education on the disease process and the need for early breast cancer screening. The theory of choice for this project is Dr. Jane Watson's theory of human caring. Dr. Watson stated that caring is the essence of nursing, and this statement summarizes what we do as nurses. Nursing, according to Dr. Watson, is a calling and not just a job. Her theory gives us a template as a guide to holistic nursing and a guide to providing culturally competent care. The conceptual framework of a theory of human caring is built around her 10 curative factors, which was done in her original work and was further expanded and renamed the 10 Caritas processes. The summary of Caritas processes is to be in the present when we provide care, be respectful, acknowledge the beliefs and practices of our patients, be a good listener, involve family members in care. Dr. Watson encourages nurses to be empathic and not sympathetic in order to achieve good health outcomes. This deep caring propagated by Dr. Watson is what is needed to be able to care for an individual with cultural practices and beliefs that are very different from ours, and this will help save lives of women in underserved communities with the potential of developing breast cancer. Millions of dollars are spent on a yearly basis for cancer treatment. The dollar amount spent increases with the increase in the staging of breast cancer at the time of diagnosis. The cost of treatment when diagnosed at stage 4 is almost 5 times the cost of diagnosis at stage 0. The quality of life of individuals with a breast cancer diagnosis, the pain and suffering, loss of work time, pain and suffering of family members cannot be quantified. Early breast cancer screening can help alleviate these sufferings. The policymakers can help by ensuring that adequate resources are allocated for enhancing early screening in these underserved communities, making care more accessible. Nurses and the multidisciplinary team taking care of these patients can help alleviate the suffering by providing culturally competent care to these communities. Education of these patients is key to improving compliance and achieving better health outcomes. This project is a community and clinic-based project. Recruitment of study participants will be done in clinics as patients come for primary care services. In the community, it will be done through religious organizations. Educational materials will be provided in the form of pamphlets and brochures done during our visits, and it will be done in the language of choice of the patients. Culturally competent videos will be shown in primary care settings when patients come for their primary care visits. Awareness lectures will be organized in religious settings with the help of religious leaders and respected family members. There will be some one-to-one awareness educations done during office visits and home visits by public health nurses. The licensed vocational nurses, medical assistants will help with setting up appointments for mammograms and setting up transportation to and from mammogram centers, as well as distribution of mammogram vouchers to help with dependent care. I'm hoping that this project will be successful. Thank you.